One of the great things that makes my job super easy is that I have surrounded myself with experts in all these fields. The low back, for example, many of the things that we treat are shot and it's done. But with the back, it's specific. There has to be rehabilitation. When a disc pops out, it's usually because there's fibers in the disc area that have torn. And the best way for me is just to show you this model right here. This is the model of vertebrae, your disc, your nerves, and your spinal cord. When these fibers here tear, which they do in everyone, this is what happens. That disc pops right out. And where does it go? Right against the nerve, right against the spinal cord. So wherever that nerve's going, you're gonna have problems. Now, it might be easy to think that we can put stem cells in there and just cure this all by itself, which it doesn't do that. So we have to do a thing called spinal decompression, which is similar to traction, but way more specialized. And it has to be spinal decompression because the decompression's job is to literally separate and pull back together. This action right here creates what's called a vacuum phenomena, which helps suck this disc right back in. When the disc goes in, the stem cells are out here healing all the fibers, and they literally close the door shut. And it heals actually stronger than before, but without both components, the results are not the same. So I don't even do these treatments unless I know that you're gonna commit to spinal decompression, because ultimately we want the best for you.
Right.
All right,
Yeah.
So, and we know the success is phenomenal. So that's what we're recommending for you. Anybody else that comes in with a back or neck issue, this is the reason right here.
The stiffness goes all around, but especially to the right. That I wrote in the paperwork hip. It's not like I have hip pain, but I feel like sometimes something is there. It's not normal.
So these nerves that come out of your low back, especially the bottom three, they all come together on each side and they form that big sciatic nerve. And that's what branches down into here. And you'll get other branches that literally wrap around like this. So
that's what I feel, like right here.
Is it common to have this? It's very common. And the very first thing that'll happen is this is gonna attack this inflammation. So it will not be long before you start feeling relief. And usually it happens before you even leave the office, you know? But sometimes it does take longer. Everybody responds differently. But know one thing, that this is definitely needed in this area. And then we'll talk about what we're going to do after the treatment as far as the decompression and how often, and then the follow-up. I want to show you these because what's important about them are the numbers that are on them. Every one of these has a tissue ID number. This is very important. This is actually registered with the FDA. These are very federally regulated stem cells, very difficult to obtain, and has to go through a barrage of testing to make sure that they're healthy before we can give them to you. So it doesn't matter where you are in this world, if you're ever going to do stem cells, you make sure they have these numbers on them. And they come cryo-frozen. They're actually stored in liquid nitrogen, which is almost negative 300 degrees. When we transport them in dry ice, which is negative 100. We're also going to give you exosomes today, and exosomes are microvesicles, and they help in the whole repair process. They're 1,000 times smaller than a regular cell, so they have the ability to go into tissue that most things can't, which is a very unique quality. So what I'm going to do is I'm going to give these to you. They're going to be yours, so I want you to just hold them. It'll take only about maybe 5-10 minutes for them to thaw out. As soon as they're thawed out, we're going to put them right in. We'll follow up so Mike can tell everybody exactly how it went. Was there a reason to be scared? Which there's not. But we had to reassure them of that. And then we'll follow up and we'll see how you're doing.